Now, the way that we treat peripheral arterial disease when it involves the legs is most importantly is to control the process that caused plaque to form to begin with. And the biggest thing is controlling conditions that are associated with plaque, things like diabetes, things like high cholesterol, things like high blood pressure. Controlling cholesterol is a very important aspect. And in fact, most patients will need to be on a cholesterol-lowering medication when they have peripheral arterial disease. The other important risk factor is smoking. In fact, that's probably the most important factor, and that's smoking. Not only can smoking cause all types of cancers and heart disease and lung disease, but it can also cause severe peripheral arterial disease. What we know is that a patient who is diagnosed with peripheral arterial disease actually has an increased risk of dying from a heart attack and a stroke. And even though that has nothing to do with your legs directly, it can be a marker for more serious disease. And that's the reason why controlling cholesterol and not smoking becomes two of the most important things that you can do when you have this condition. If the condition becomes more severe, in which you are limited in your ability to do the things that you like to be able to do, then we may start off employing exercise and medication to see if we can improve your walking distance. That is in addition to, again, not smoking and lowering one's cholesterol. If it gets bad enough where either the exercise and medication doesn't work, or your lifestyle is severely limited, or it is so severe that you're having those symptoms at rest, then we may have to consider getting better blood flow down to the legs. Now, there are a lot of different ways of getting better blood flow down to the legs. The least invasive of which is to pass a wire from within the artery, past the blockage, and basically open up that blockage. We can open it up with a balloon that expands it and essentially squishes it over to the side, or we can use what's called atherectomy, which is basically either sanding or scooping out the plaque, or we can use stents, which basically holds those arteries open once we've opened them up. Now, those are some of the minimally invasive techniques. If those techniques are not sufficient to provide us with the type of increased blood flow that we need, then we may have to do things like cleaning out the artery directly, what we call endarterectomy, or even bypass the blockages altogether. The important thing is that, number one, not everybody requires the same thing. In fact, not everybody even requires a procedure being done. Number two is that patients do require different types of treatment depending on the severity of their condition and their individual needs. And it is important to talk to your vascular surgeon, your vascular specialist, about where you fall in line to make sure that you're getting the appropriate treatment.